strengthening exercise for your quad. It's referred to as a quad set. He's going to have his leg out straight, and what we're going to instruct the patient to do is try to press the back of his knee towards the table and tighten his thigh or contract his thigh muscle. So, okay, try to press down into my hand. Okay, you see he contracts here, and his knee gets straighter. Okay, and should almost be touching the mat at that point, or the table, wherever they're performing at home. Just for patients who maybe right after a surgery who don't have the strength that they should yet, it's a little less stress on the joint. He's going to maintain contact with the pillow, or in this case the bolster, okay, with the back of his knee. And all he's doing is going to kick his knee up slowly, okay, until he gets into full extension. Stop there, and then come down slow. And again, control the motion on the way down. Don't just let it fall down. Okay, so we're going to bring it up again. Hold it until he feels a contraction here. He gets that full extension, and then come down slow. Control it on the way down. Okay? So you got a good hold there. And all the work is being done by his upper body. So he's not raising the leg with his muscles. He's actually doing all the work with his upper body. So he's going to bring the leg up straight, okay, until he starts pulling behind the knee and then running down his hamstring. Count to 20. And then once he gets to 20, he can kind of bend the knee and give it a little slack to give it some rest, okay? And then once he's ready again, he can bring it back up. And then again, once he's rested, he can just give the hamstring some slack and take it off and stretch. Lower back down now. He's going to go over his shoulder. And again, all the work's being done by his arms at this point. So his knee is totally relaxed. He's just pulling up his foot, okay, and bending his knee until he starts to feel a stretch in his quad or in the front of his thigh. Bring it all the way down. And then I'll repeat that again. Bring his heel, kind of bringing your heel towards your butt. Holding it for a count of 20. And the idea being, ideally that you get a little bit extra range each time. You can bring it a little bit further each time. So again, bring his feet about shoulder width apart. Okay, you can bring his hands out in front of him for balance, okay? And he's just going to sit as if you're sitting down into a chair, okay, and squat down. He's going to come down as far as he feels comfortable, and then come back up slow. If you're not getting the hang of it, put a chair behind you. You can practice as if you're going to sit into a chair or like a table like this. So you want to come down as if you're going to lower yourself to the seat, and you can kind of use that as some feedback. And once you get there, then you come back up, okay? Coming down slowly, again, it's controlled on the way down, and then controlled on the way up.